goal too big for this recent Fresno State grad, how even cystic fibrosis couldn't keep her from walking across that stage. A one-on-one talk with Fresno County Sheriff, how she fought breast cancer and won.
If they can get me 2 or 3 more years, I'd be appreciative.
And living with lung cancer, a look at one man's treatment and the program bringing the latest advancements right to you. Hi there, and thanks for joining us. I'm Julie Musgrave. We begin today talking about the cystic fibrosis program at community medical centers. It's only been in place for 2 years, but it's already nationally accredited. And it's the only center in the area that takes patients from childhood to adulthood. One of those patients just completed a major milestone, one that wasn't really possible at the time she was born.
I think graduates, they deserve an applause. What do you think? Thank you.
On a warm Friday in May, Blaire Strohn walked across the stage at Fresno State and took home a degree.
Blaire Strohn.
But what makes this walk so special is that she did it with just 20% capacity of her lungs.
Try breathing through a straw. That's what it feels like for us on a daily basis.
Blaire has cystic fibrosis, a genetic lung disease she was born with that can eventually lead to progressive organ failure.
A big challenge, but I don't want it to bother me.
Blaire's day starts hours earlier than the average college student. She gets up, takes her medicine, does a breathing treatment.
3 times a day, 30 minutes each.
Chest physical therapy.
All before she could even try getting out the door.
20 years ago, the average life expectancy was only 21 years old. Today, it's about 40.
Dr. David Lee has treated Blaire since she first moved here from the Hollister area. Before, she'd have to travel a few hours for treatment at Stanford and stay there for weeks at a time. Her travel time now is just 5 minutes.
When you came here without specialty care, she wasn't sure if the doctors here were up to speeds, and that's the honest truth.
Fresno's weather and air quality took their toll on Blaire's lungs, and being an ag communications major, she's out working with livestock and dust often.
We made some real tough decisions together.
Last year, her health took a turn for the worse.
When I first came to Fresno, I just had my nebulizer and my vest that we have to use on a daily basis for our medical treatment, but over time my lungs have basically shrunk, and so it's hard to breathe. So I require now to have oxygen not throughout the day, but when I need it. And then I have a feeding tube now.
Then she qualified for a lung transplant, but with just 1 year of college to go.
If you're going to live to 40, you're going to have to get a job.
They made the decision together to hold off.
After graduation, I want to continue the ag field. I want to, especially in the marketing for agriculture, being a voice and advocate.
And at her graduation ceremony, with Dr. Lee celebrating by her side,
She's an amazing person.
Their unconventional decision paid off. Blaire's walking away from Fresno State not just with a degree, but a whole life ahead of her. Blaire still plans on getting a lung transplant, but right now she's technically too healthy to qualify. This fall, she'll begin an online master's program through Oklahoma State University. By the way, Dr. Lee and the cystic fibrosis program received a national grant earlier this year to the tune of $88,000. It's from the Cystic Fibrosis Foundation. The money will help fund a dedicated CF pharmacist and provide specialized training for patient treatment. The Fresno County Sheriff is another example of one strong woman, and not just on the job. She beat breast cancer too. We sat down with Margaret Mims to talk about her experience at Clovis Community's Marjorie E. Radin Breast Care Center from diagnosis to now.
Sheriff Margaret Mims, thank you so much for joining us today.
Oh, you bet.
Now, a lot of us, we know you as a tough enforcer of the law, but what a lot of folks may not know is that you're tough in another way. You are a breast cancer survivor. When were you first diagnosed?
I was diagnosed in February of 2008.
And you sought treatment from Clovis Community Medical Center. What was your experience like?
Well, everything happened very quickly. I had my regular mammogram in January, and in February then I get the telephone call from the pathologist, and he told me He said, "You have a little problem here." And then he went on to say that I had malignant breast cancer. So it was a very tense time. You know, I was diagnosed in February. In February, I had my surgery. It happened that quickly. And the important thing to a patient is getting rid of that wait time when all you do is worry about what might be happening. So that really put closure to it very quickly, and I appreciated that.
Let's talk specifically about your time at the Marjorie E. Radin Center.
All right.
What was that experience like?
Well, I felt accommodated. I have a large family, and of course everybody was worried, and my family felt accommodated. I felt accommodated, and as I talked with other patients, especially during my checkups with my oncologist, nobody treated me special because I was the sheriff. Everybody got treated that way, and I think that says a lot about the care there.
What do you think the key was when you were going through treatment and making you not feel as scared?
The ability to make my own choices was really helpful. When the doctors, the surgeon, the plastic surgeon, the pathologist, when they all gave me choices, here are your options. And to me, you might not be surprised, I like to make my own decisions and be in control. And I really felt I made my own decisions, and the team supported that and then moved forward with their best treatment. And I really appreciated that.
I think a lot of people, when they hear your story, they will really look up to you in a new way, a different way. What do you think that means to others?
Why I think it's important to get the word out is the patient is so involved, because I know I was, in trying to make decisions when you really don't have the complete information, and you've never been through this. You learn a new language. All of the things that happen behind the scenes with the doctors getting together and coming up with a plan that really is not made aware to the patient because there's other things to worry about.
And now you've been cancer-free for how long?
Well, almost 10 years. I passed the 9-year mark, and I will tell you, for a cancer survivor, when you get past the 5-year mark, that's quite a milestone, because then you can actually say, I'm cancer-free. But the 10-year mark is going to be very important to me.
And how are you feeling?
Feeling great. I'm feeling great. All my checkups were great. And I don't have time for cancer.
Sheriff Mims, we certainly appreciate you telling your story with us. Thank you.
Still to come on Medwatch today, a friendly face when your health meets an emergency. This week's healthcare hero. Plus, an uptick inside community medical center emergency rooms. Safety advice for when that Central Valley heat sneaks up on you.